everybody, welcome back to a special Monday night episode of Pick Dr. Osborne's Brain. We got a great show for you tonight. We're going to talk about why it's all in your head. Not really, that's kind of a joke, but it's a topic that I think needs to be addressed, a big psychological topic, because that's what a lot of people get told. They get told it's all in their head. So, we'll be talking tonight about headspace, in a sense, and you know the drill. If you're new to Dr. Osborne, to Pick Dr. Osborne's Brain, then let's get you acquainted with the rules of the show. Kind of basically what we want to make sure that you understand is that number one, we're trying to get this message out to help save 100 million lives. So if you find this video and this information helpful, we ask that you share it. Number two, participate, ask questions. If you ask questions at the beginning of the show, I'll do my best to get them answered, provided the topic is relevant to the show's topic as well. Tonight is going to be a little bit of a free-for-all because of the topic. Now, number three, if you haven't already picked up a copy of No Grain, No Pain, highly encourage you to read the authoritative book on overcoming autoimmunity. It's a fantastic book, especially chapter 7 and 8 if you're looking for a diet to follow to move the needle in the way of autoimmune disease. That's where it's at. Number four, go over to glutenfreesociety.org and pick up a copy of our free gluten-free survival kit. It's there to help teach you, kind of navigate you through the pitfalls and mistakes that people make when they're originally going on that gluten-free diet. So, also, lastly, let me know where you're from. I love to see how far we're reaching out in the world and the impact that we're having on the community. So, don't be a stranger, chime in and say hello. Let me know where you're tuning in from in the world. And we'll get started here. Looks like we already got a bunch of folks chiming in. We got Leslie from Colorado and Wanda from Tennessee and Laura from Ontario, Canada, Lisa from Las Vegas. We got another Lisa from Kentucky. We got Christine from Massachusetts, Kathy from Ohio, Misty's back. Welcome back, Misty. She's over, she runs the Scleroderma and Functional Medicine Facebook group. We've got Dana from Ontario, Peruz from Los Angeles, Tricia from South Texas, Becky from Katy, right in my backyard here. We got Australians tuning in, Leanne Bloom from Australia, so across the pond. We got Peter from Sweden. We've got Fenton from Kilkenny, Ireland. So we're reaching the globe tonight. We're going all over the place with our message. Thank you so much for tuning in, those of you tuning in from far away. We've also got Sandra from Florence, Kentucky, and Rufina from Arizona, and Joan from Missouri, and Wendy from Georgia. We've got another Australian. I don't know how to pronounce your name, so I'm not going to try and mangle it. Let's see here. We got Dorothy from Danville, Illinois. We've got Sagemont. Susan, is that Sagemont, Houston? That's kind of my old stomping ground if it is. Interesting. Amanda Wilson from Texas, and Sophia from Canada. So Canada's representing pretty strong tonight. So again, get those questions in. Now, I'm going to ask you a question as we're walking through tonight's show. How many of you listening tonight have ever been told that you go to the doctor, right, and the doctor says, it's all in your head? And what do I mean by that? There's a couple of different scenarios where we see this come to fruition. And that one scenario is that you go to the doctor, you have a health issue, they run a bunch of lab tests, all the lab tests come back perfectly normal, they look at you and say, you're healthy as a horse, it must just be all in your head. You're probably either depressed, or if you're not depressed, you probably have an emotional problem. Let me refer you over to the psychiatrist, and we can get you on some medication in that regard. How many of you have had that scenario? If you've had that scenario, just type in for me #headspace tonight in the chat feature there, and let me know. I want to see how many of you have ever actually had your doctor accuse you of lying. Now, what's ironic about that is you go to the doctor, like your time is really valuable, just like my time. All of our time is valuable. Time is the one non-renewable resource in the world, right? So, like, you don't go to the doctor just for the sake of going. Usually when a person goes to the doctor, they're not feeling well, they're sick, and they have a real genuine issue. And so when you hear this message, it's really, in my opinion, it's quite insulting. And it should be insulting to you too. Your doctor's accusing you either of lying or accusing you of wanting to waste his time or accusing you of wanting to waste your own time, right? Which is not at all why people go see the doctor. People go see the doctor because it's not all in their head, because they actually do have a problem. And just because you reach the limitation of the doctor's brain, right, doesn't mean that it's in your head because he hasn't been able to figure it out. It's still a very, very real problem. And that's really, frankly, that's what tees me off, is I get so many people that come to see me in my practice here in Sugarland, Texas, and this is what they've been told. It's all in your head. And they've either been sent to the psychiatrist for antidepressants, or they've been told they have too much stress in their life and that they need to de-stress, in a sense. So what does that really mean, to de-stress? So if you've been told that, again, type it in, #Headspace, and let me know kind of what kind of audience we've got joining us tonight. So let's just see here what kind of responses that we're getting in that regard. Somebody's asking, not on the space of the question. We got a bunch of headspaces coming in tonight. Yeah, I don't love it that you guys have gone through this, but I love seeing how many of you have gone through this and come out on the other side. That's what gets me excited. Somebody's asking about Warrior Bread Mix on here. Does Warrior Bread Mix have peanut? Is it peanut free? The answer is yes, it is. Okay, so let's. I like that. Somebody says if my doctor says that to me, they're fired. I like that. I like that you would fire a doctor who accuses you of wanting to waste your time and that you're actually crazy and not actually viably having symptoms. Yeah, so lots of you chiming in with Headspace. So, okay, so we're talking to the right people tonight then. So, it's in your head, not really. So let's talk about what I want you guys to understand, where the limitation is. Because if you've ever been told it's in your head, I know how ultimately frustrating that can be. And so many people come to me with that. First of all, they've been accused of lying, and then second of all, they've been sick long enough that they're starting to doubt themselves. And so it actually does become part of what's in their headspace. It's the chronic illness, right? The chronic illness that causes, where their chronic illness sets in. Then you have doctor accusation of craziness. Then you have what's known as self-doubt. And with self-doubt, sometimes what happens, and it just depends on your relationship, sometimes you get the family doubt that comes with that. So you're sick, you've been called a liar, you start doubting yourself and doubting whether or not you're actually sick, and then family members can actually start to doubt as well. And so then there's this huge amount of pressure that can come out of this terrible scenario, which is medicate it into the ground, right? Medicate the symptoms, which is an absolute ludicrous thing to do, because medicating the symptoms of illness don't fix the symptoms of illness. You're not sick. Nobody ever got sick as a result of a medication deficiency. It just doesn't work that way. So, but that's the pressure. This is what happens, right? When it's in your head, so to speak, and you're accused and you're doubting and your family's doubting, and the pressure is on to just get better. So, like, just feel better. Not necessarily get better, but just feel better by medication, right? And we all know, if you've been listening to me for any length of time or following me for any length of time, you know that that's not a solution. That's a Band-Aid. That's like putting a Band-Aid over a wound with bacterial infection. You can hide it from sight, but the infection's not going to go away until you actually address what's causing the infection. And that's the same thing with chronic illness. And this is where a lot of times the doctors completely fail people, is they accuse. They accuse instead of validating you, instead of saying, hey, look, I get it. We've reached the limit of my knowledge and expertise and my ability to help you. I understand that you're sick. I'm not going to tell you that you're not, and I'm not going to tell you that you're crazy or that it's all in your head. And when I say tell you that you're crazy, it's not that the doctors are out there saying, you're crazy, Mrs. Jones, but it's how they say it. It's, you're just depressed. Or you just need to, maybe you just need to take an antidepressant, or maybe you just need to have less stress. They're basically saying, because I don't know what in the heck is wrong with you, do these things and get out of my office, because I don't want to spend the time to figure it out. That's really the message, right? And that's a frustrating place to be, especially if you've got this doctor accusation, you've got self-doubt, you've got family doubt, maybe you're not quite ready to go that direction, so what do? You visit another doctor, and maybe the outcome is kind of a repeat, right? And so you go through this pattern repetitively and repetitively and repetitively. And again, the reason I bring this up is because this is the psychology behind many of the people that come to see me in my clinic, is they've been through this 7, 8, 9, 10 times. And so they're at a point now, I said earlier, where you're here, you've kind of buckled and broken down, and you're here, and you're still doubting yourself possibly, but you're also still sick. And what happens is now, on the tail end of this whole thing, family doubt, self-doubt, there's this huge point of frustration, right? Yeah, it's the frustration. It doesn't matter what kind of expert or specialist I go to. It doesn't matter what kind of doctor I go to. They're all just telling me the same line. And I end up in this point of frustration. And then with this frustration plus the illness, it starts to erode on the psyche. It starts to break a person down, and it starts to make their headspace doubt themselves, and that in and of itself feeds the chronic illness. So we've got this chronic illness, and this frustration plus that chronic illness feeds in, and it increases that chronic illness. So then stress and frustration and mindset actually start feeding the illness. They didn't cause the illness, and it's an important note to make, is this is not the cause of the illness. The going through this system of craziness is what created the frustration that fed the illness and made it worse. So it's very, very important that you understand that part, because if you're sick, you're not crazy. You just haven't come across somebody who's either caring enough, loving enough, or patient enough, or has enough time to give you to actually look at investigating what in the heck is going on. So all that being said, I want to introduce another concept to you tonight. This concept is probably one of the most important concepts you could understand. This concept is called the triangle of health. So I'm going to draw you a nice pretty picture. I'm not a great artist, but you'll get the gist. So, the triangle of health, you all have one. Everybody has one. At the center or the core of this triangle are your genetics, your DNA. Now, how many times have you heard a doctor, in his frustration of not knowing what's wrong with you, want to jump directly to blaming DNA? You have bad genes, you're getting older, like these are the things that happen, right? These are the excuses for not being able to help you. Let's just make a little list over here. Excuses of not being able to help. So one is, you're getting older. 2, stress. 3, depression. 4, it's all in your genes. You just got bad genes. You just inherited crappy genes. Excuse my language, but that's, this is a point of frustration and contention for me. Because our genes are not evil. They're not bad. Our genes are what? Our genes are a gift. And that's the way I want you to look at it. Because if you look at it any way, and any differently, think of your genes, they're a gift from God. If you're not religious, they're still a gift because you're alive. And just the fact that you're alive is better than the fact that you're not alive. So your genes are a gift that are not designed to make you sick. Your genes are actually designed to do what they're told to do. In essence, your genes are largely influenced. Your DNA is influenced by this triangle. Let's talk a little bit more in depth about what this triangle means. So one wall of this triangle, we have physical. On another wall of this triangle, we have the biochemical or chemical. And then on the last wall, we have spiritual / emotional. And each of these walls of the triangle influence the behavior of your genes. Now, the way I want you to understand your genes, aside from the fact that they're a gift, is that your genes are a lot like light switches. You can turn a light on, you can turn a light off, and it's not the gene or it's not the light that's necessarily bad. If I'm trying to go to bed, the light being off is a good thing. It's going to help me sleep. But if I'm trying to read a book, I want the light on. So it's not the gene. It's the circumstance around the gene. It's just like it's not the light, it's the circumstance around the light. It's no different here. If you are, for example, a diabetic, and you're making chemical choices every day to eat tons of sugar, to eat poorly, and to not exercise physically, what you're telling your DNA to do is to protect you from those choices. So what happens when you eat a lot of sugar? You activate the genes that help you make more insulin. What happens when you don't exercise physically? Your muscles atrophy and your ability to tolerate higher levels of blood sugar is minimized. But that makes diabetes worse. But what's happening is you're not exercising, so your genes are just adapting to your lack of physical activity by saying, look, you're not going to use any muscle. We're not going to spend a bunch of effort making extra muscle. So it's your choices that influence the behavior of those genetic light switches going off or on. And that's what leads to an outcome. Now, what doctors love to call disease, and let me make a little bit more room on the top here. Because doctors love to blame these things on why a person might get sick. But the reality is, disease is your body adapting to poor behavior. And really, it's not even necessarily that it's poor behavior, but it's behavior that you are having that doesn't accommodate the genetic light switches in a manner that's consistent with the expression of good health. For example, I'm going to give you a very acute example here, and it'll make better sense in a minute. If you go underwater and try to breathe, what's going to happen? You're going to drown. If you jump off a cliff and try to fly, you're going to fall. You're not going to grow wings. You're not going to grow gills if you go underwater. Your genes are not going to adapt to a poor behavioral choice acutely. In essence, what will happen is you'll drown or you'll fall to your doom. That's not disease, that's death. But if we take chronic disease, so that's an acute example, meaning a quick example. If we take chronic disease, which is poor exercise, poor diet over time, your body is adapting to your poor behaviors, and the symptomatic outcome of your poor behaviors is what we call disease. And so then doctors will classify you with a name, and then that disease classification just basically serves to identify which drug we can use to artificially manipulate your chemistry so that we don't have to have an uncomfortable conversation about changing your behavior. How many times have you been to the doctor where they don't even have a meaningful conversation? How many of you, let's just ask that question to the audience, how many of you been to a doctor where they gave you medication but they didn't sit down and talk to you about exercise, what kind of exercise? They didn't sit down and talk to you about diet, what kind of diet that you needed to follow? If you've never really had the opportunity, or you've been to a doctor and you haven't had that conversation, what I want you to type in is just #disease. Type that in and let's see how many of you have gone to a doctor and been given drugs without being given solutions. I'd love to see. I'm very interested in the answers that we get. Let's just see how many give us that that delineation. Looks like a bunch of you are already coming in with that delineation. So again, type in #disease if you've been to the doctor and they never had the conversation with you, the meaningful conversation, but they just pulled out the script pad and said, here you go. So, okay, good. So I think I'm talking the same language here to you guys still. So going back to this then, if disease is really your body's loss of ability to adapt to bad choices, because that's the way, if we want to really boil it down, disease is the loss of your ability to adapt to your choices. So your body can no longer keep up with your bad choices, and then it starts to become symptomatic. Those symptoms are just a manifestation of your body's warning system. Your body is screaming at you saying, stop it, do something different. I want you to understand, again, we've got 3 different walls of this triangle, and each one is worth 33% of your health minus your genetics. So, I mean, if we ask most geneticists and most researchers, they're going to tell you that your disease, whether or not you develop autoimmune disease, whether or not you develop chronic degenerative disease, is not so much genetic, although genetics can play a role. There's definitely a role genetics plays. But most agree that if we're doing the math on this, that about 30% of the total risk comes from genetic undertone, and 70% comes from the choices that we make on a daily basis. So my point in saying that is you are far more empowered at making changes in your environment to influence the behavior of your genes than you are to change your genes. So we can't change what our DNA is, but we can change how it's being influenced, right? And so when we take and make different physical, chemical, spiritual, emotional choices, this is actually what we're trying to do. And this is what functional medicine is all about. Those of you who've ever heard of functional medicine, it's the application of the three walls of this triangle to influence the behavior of your genetic code so that we're expressing health instead of illness. Now, we're trying to get you in this direction. So understand this, that disease and illness and health, really the whole spectrum of health, it very much is a spectrum. On one end of the spectrum, we have perfection. On the other end of the spectrum, we have death. And if you're watching this show, you're not perfect. None of us are. And if you're watching the show, you aren't dead. So you're always going to be somewhere between perfection and death. Always. We all are. But it's where on the spectrum you fall. If we want to feel good, if we want to have good function, if we want to be adaptive, we call that zone here wellness. And that's where most people they're striving to achieve a state of wellness. Wellness doesn't mean perfect. It doesn't mean you can't get sick. It doesn't mean that you never, or that you feel good 100% of the time. But wellness means that you can adapt really, really well in your environment and thrive in your environment, as opposed to the opposite. On the other end of the spectrum, there's functional illness. And this is where the vast majority of Americans fall. The vast majority of people that live in industrialized countries fall in this functional illness category, meaning they can get up and go to work, they can brush their teeth, they can put their shoes on, get dressed, but they feel bad and they have chronic illness. They have some form of either chronic autoimmune disease or some form of chronic behavioral disease, and they don't feel well. And it's not a very far step from here to death. I mean, this is when a person's on multiple medications. This is when a person is basically masking the symptoms of their disease by suppressing the symptoms with drugs to stay alive longer, but they still are not achieving great health. Whereas over here, this is the person that is identifying their choices and where they can make better choices and where they're making bad choices, and so they can start making different choices to basically nourish their DNA to express in this direction. So again, now that you kind of understand the underpinning of what functional medicine is, I want to go back to tonight's topic, which is, it's all in your head. I said earlier that depression, or emotional grief, if you will, comes after long years of being sick and being told that it's in your head. It creates a spiritual emotional imbalance. It's not that the spiritual emotional imbalance in many cases of chronic illness actually was causing or contributing, because a lot of times when people get sick, they're spiritually and emotionally sound for the most part, and it's not this that creates the disease. Now, that's not to say that it can't create the disease, because I've seen cases where this did. But when you've been told by your doctor that it's your age, your stress, your depression, your genes, that's a very depressing scenario, right? So we get that depression scenario. Well, now this depression is influencing the behavior of your genes. And when you're psychologically depressed all the time and your genes are being activated in a manner that's going to drive you in this direction, what this represents, if we really want to just put a word to it, it represents hopelessness. Because what you're being told is that there's nothing you can do. There's nothing that can empower you to make adequate change. And when you're hopeless, you're definitely depressed. And you don't have an answer, you don't have a solution, and you don't have any steps of action that you feel confident that if you take will lead to a resolution. This can create a major, major cycle. Now that depression is feeding into your genetics and driving you in this direction, and it keeps you in that direction. So again, even though this came after the illness, right? The accusations and the doctor misinformation came after it. It created a state of hopelessness, or it created a state of dependency, because maybe maybe your doctor said, maybe he said, there is hope. There's this drug that we can give, right? And this drug it's a great new revolutionary drug that's going to change your life or whatever, but even though that drug doesn't lead to any kind of real resolution, it basically gives you a false sense of security under the guise of compassion. In my opinion, that's what these do. Now, there are times where, I'm saying this in broad spectrum, because if you've got a major infection in 104-degree temperature and it's a bacterial infection, you take an antibiotic, that drug is a cure. But aside from the antibiotic, there are very few examples of medications that actually provide a cure for disease. Most of them are designed to treat the symptoms of disease, but not to actually treat the underlying cause of the disease. And for example, if you look in the field of rheumatology, most of the drugs are designed to suppress the immune system or block inflammation. But none of the drugs ask the question where the immune system has gone wrong or why the inflammation exists. And if we really want to know the underlying reason, we can't just develop drug dependencies, because these give us false sense of security, because they can help your symptoms, but they're not going to get you here. No drug will ever get you here. Drugs do not create wellness. Physical, chemical, spiritual, emotional equality and balance are what bring you wellness. So, what are some examples here under this physical category? For moving into that physical category, one of the best examples I can give you is obesity. Obesity is an inflammatory condition. I don't care what you hear, see on the media. Sometimes media actually tries, I see shows where they're trying to glorify big and beautiful, when in fact what they're glorifying is inflammatory obesity. Obesity is a state of inflammation. We know that. It's been very, very well studied. It's a physical condition as well, because the bigger you are, the more that you weigh above what your frame is designed to carry, the more stress and pressure you put on your vascular system, on your heart, the more stress and pressure you put on your physical system. So, you ever try carrying 10 pounds around all day, and how much more tired you feel when you're able, or how much easier it is to move when you take that 10 pounds off? Like that, imagine somebody being 20 or 30 or 40 pounds overweight and carrying that much around. It's that much more pressure on their shoulders, on their knees, on their ankles, on their back, on their spine. And it will wear away and wear away at you. So obesity is a perfect example of a physical aberration. Another one is scoliosis. Somebody with a severe bend in their spine and they have to walk crooked. We might have people with chronic muscle aches and pains where they develop limps, or they develop what are called antalgic gaits, where they change the way they move and walk in order to try to avoid the pain. So these are all kind of examples of physical aberration. Now, you don't even have to be overweight. You could be not obese, but under-muscled. That's another type of physical problem. So being under-muscled, remember what physical is. There's an old saying, an old adage, square tires don't roll. Structure dictates function. So if you don't have adequate muscle, that's structure, that's structural. If you have too much fat tissue, that's structure. If you have an abnormal curve, that's structure. If you have a sprained ankle, that's structure, right? So structural issues here. If you have a lack of physical movement, a lack of physical activity, a sedentary lifestyle, those are all choices that we get to make every day. You may not choose to have scoliosis, but if you choose to sit at a desk and you never exercise and you never stretch and you never do the nourishing component to your physical body after putting it through a potentially abuseful sedentary situation, then you're asking for trouble in this physical category. Then we have the chemistry. And the chemistry, predominantly what is chemistry? Chemistry is food. It's what's in the food. So, it could be food flavoring, it could be food additives, it could be dyes, it could be chemical preservatives. So we'll just use the connotation chemicals. And that chemicals in the food, but food plus the chemicals in the food. But it could also be chemicals in the air, chemicals in the water. Many people are exposed, for example, to heavy lead. If you remember Flint, Michigan a few years ago, where the lead contamination played a major role in making a lot of people sick. So food and chemicals. We also have microbiome issues, so like bacteria, yeast, viruses, parasitic microorganisms. So these are all chemistry. These are things you can't see with the eye. These are things you can see with the eye. These are things you can't necessarily see with the eye, but you can measure with the microscope or with technology. So the chemistry, if you're eating the wrong food, if you're being exposed to lots of chemicals, if you're malnourished, if you don't have adequate quantities of vitamins and minerals, if you have bacterial overgrowth or infection or other kinds of problems, these are examples of chemical reasons that we can develop or create a chemical imbalance. And again, this is not all inclusive of everything, but it's just, I want you to understand the concept. And then we have the spiritual and emotional. And if this is your background, coming from that, seeing 7 or 8 or 9 doctors and being told that it's in your head, that it's your age, that it's stress, depression, or that it's your genes, and you're in a state of depression, then you've got either drug dependency or hopelessness or a combination of the two, and that's feeding into this as well. But understand, you could also have, as an example down here, you could be in a job you hate. You could have, I'll call it a soul-sucking profession, right? You could just literally hate going to work every day. So that could be, for many people, you could have relationship issues. You might find yourself in an abusive relationship. And abusive doesn't mean somebody's beating on you. It could be an emotionally abusive relationship. It could just be a relationship that's not the right one, that makes you very, very unhappy and creates a spiritual emotional imbalance, right? So again, these are all just examples, but I want you to understand is that each wall of this triangle influences the behavior of your genetic light switches, but each wall of this triangle also influences the behavior of the other wall. So not only that, we have interaction toward the DNA, but we also have interaction toward each other. This is holism, and this is why you can't, in traditional medicine, in allopathic medicine, what happens is, if you go see an orthopedist, for example, and this is not me saying orthopedists are bad people, but what do? They look at you physically, right? They'll look at you physically, and generally they'll offer up physical manipulation, what is physical manipulation? Like a surgical procedure, right? And maybe they'll send you to physical therapy. But again, even if it's physical therapy, they're addressing the physical without looking at chemical or spiritual emotional. You can't just address one side of this triangle and expect that the other two sides are going to fall right in place if you've got problems in all three areas. For example, most people with chronic illness don't just have a physical obesity. They generally tend to have something like a physical obesity. They're eating foods that they shouldn't eat. They're being exposed to chemicals they shouldn't be exposed to. Their foods have created a yeast overgrowth. They've got emotional problems because they hate their job, right? And so it's this combination of different things that I really want you to understand. And if nobody's taking the time to ask these questions in these different areas and really analyze it and really look at it under a microscope and then offer up guidance based on this information, then you stay here. You stay stuck in this area of hopelessness, in this area where you're using medications to mask or to suppress your symptoms. And this is a horrible place to be, right? And that's why, understand, this right here requires a ton of work. This right here requires a ton of action taking, and it requires a ton of courage. And not everybody has the courage to walk away from this and say, look, I'm going to look at myself in the mirror, and I'm going to get with a doctor who understands this type of concept, and I'm going to do the work that it takes. Because no matter what doctor that you have, if you've got problems in these three areas that you're not willing to address, you'll never get better, no matter how much you understand this, if you're not willing to take the action. Because nobody's going to give you a pill or a passive therapy that's going to correct these problems for you. There's no weight loss pill that's going to correct obesity. How many times have we seen that happen in marketing, where a new company came out with a new pill, another company comes out with another pill, another company comes out with another pill? What's always the outcome when people rely on pills to fix their problems? The outcome is their problems don't go anywhere, or their problems morph. So this requires work, right? And so it requires the right headspace, right, to overcome this, to get here, then to be able to do the work and to move forward. So I wanted to have that conversation with you tonight, because if you're struggling with a chronic illness and nobody's ever broken it down to you this way, nobody's ever explained it to you in this way, I want you to understand this, because now if you move forward with this in your head, then your headspace changes and hopelessness goes away and hope comes back, and now you are empowered to take the action. So with all that being said, I'm going to go through and we're going to answer up all the questions tonight. So if you've got questions, go ahead and make sure you chime in and ask them now. Yeah, so a lot of you just validating what I'm talking about, going through periods of hopelessness, going through periods where doctors try to steal your power, so to speak. Mary says, Dr. Osborne, are you helping doctors? Are you attending symposiums to help them to help us? Mary, interestingly enough, I put on a symposium every year for doctors to teach doctors this very kind of thing. I have doctors come visit me in my clinic to shadow me on a regular basis for this kind of very thing. So to answer your question, yes. Understand what doctor means. Doctor means teacher. And teacher means student. So not only should doctors be in perpetual learning mode, right? They should be in perpetual teaching mode. So I take that part very seriously. I teach every day, but I'm also learning every day. Oh, I like this. Dickerson says, my reason for no longer practicing conventional medicine, had to go back to school to get certified in functional medicine. Love that, Dickerson. Way to. That's just awesome, because I mean, I know what kind of courage that took. And those of you who've had bad experiences with medical doctors, don't beat up on them too bad. The quantity of courage it takes to shift over from a traditional practice to a functional medicine practice, that's not easy. These people have families, they have livelihoods, they got to support. I'm not saying that they shouldn't make that conversion. I'm just saying it takes a lot, just like it takes a sick person a lot of courage to do this, it takes an allopathic medical doctor a heck of a lot of courage to come learn this and admit that what they've been doing for 5, 10, 15, 20 years is not been the right things. Like, that takes a heck of a lot of fortitude to come to that decision. Okay. So Marcia says, any foods I should avoid with multiple sclerosis? I haven't been diagnosed yet, but have so many symptoms going crazy. Yeah, Marcia, get you a copy of No Grain, No Pain. And the diet itself was designed for autoimmunity, and so it's a great place to start. Start with Chapter 7 and Chapter 8. Those are the foods that you want to make sure that you're looking at. Okay. Yeah, lots of you just chiming in on the frustrations that you've had. Let's see here. Yeah, they're just, again, a lot of times it's the training. Understand that, I always like to say, understand what you're getting when you go into a medical practice. You're going to get advice on which drug to take to mask your symptoms. That's what they do, and that's what you're going to get. I think a lot of people are disenfranchised by medicine because they don't understand what they're signing up for. They think in their own mind that doctor's been trained in nutrition and lifestyle medicine, when the average medical doctor has less than 7 hours of nutritional training in an entire 4-year medical school. So anything they get either comes after medical school or on their own dime, on their own time, apart and away from medical school. So understand what you're getting when you're going to a doctor. If it's a medical doctor, you're getting somebody who's trained to dispense medicine. You're not getting somebody who's trained to dispense nutritional and lifestyle guidance. So Dawn wants to know, what's the best test for checking for SIBO or parasites? There is no best test. I mean, for SIBO, probably one of the better tests is a breath test, a methane and hydrogen breath test. For parasites, there's different types of testing because, stool test can be accurate, but sometimes it's not. Sometimes you've got to do DCNR, or not DCNR, but PCR DNA testing out of the blood. Sometimes antibody testing can pick it up. It depends. So this is going back again to don't if you're watching this show, don't try to handpick tests and go get them done and do it on your own. Really, really, truly find somebody who's entrenched in this, because look, I've been doing this 20 years. And if I had been doing it only for a year, there's no way I would have the vast quantity of experience that I have today that helps me understand why one test isn't perfect for everyone and why there's not just like one thing that you do every single time. Yeah, so that's a scenario, Linda. My doctor only gives me 10 minutes, which leaves her no time to explain anything. Yeah, I mean, that's the scenario. Again, when you go into a medical office, expect that you're going to get the standard of care, which is 5 to 10 minutes with the doc, one copay, one problem. and medication. That's pretty much the standard. Let's see, Glenda, I have a question. I'm wondering why weight can go up and down. I begin a healthy lifestyle, cleaning my diet up and chemical out as much as possible. I lost 75 pounds, but I get to a place and sabotage myself and revert back to old habits. Well, I think you just answered your question. I don't need to answer the question. If you get to a place where you sabotage your success, then you may have something with your headspace. There may be something there why you're sabotaging, and that might be worth kind of looking into and diving into. Generally, when people revert back, at least in my experience, it's because the social temptations, they've left the social temptation of society in place without addressing it properly. What do I mean by that? I'm going to use gluten as an example. When you go gluten-free, a lot of times people go gluten-free, but then when they go to a relative's house or they go to eat out with friends or whatever it is, they haven't had the social conversation to basically let their loved ones and their friends know, look, I'm not doing that anymore, so don't try to pressure me into doing that. And so because they haven't had that conversation, there's a level of peer pressure and guilt, especially if somebody made you some food, right? There's a level of guilt, and so you fall off the wagon repetitively because you haven't addressed the psychological need to let people know where you're going with your diet and lifestyle. It's a huge mistake I see repetitively made, and I don't know if that's your issue, but it's certainly something worth looking at and thinking about. Okay, let's see here. Okay, so I like this. So Carolyn says, I've had hypothyroidism for years and asked why I had never been tested for Hashimoto's. Doctor said it didn't matter since the treatment's the same. It's only the same for Western medicine. It's the same. The medical treatment's the same whether you have Hashimoto's or whether you have another form of hypothyroidism. But I would argue that the difference between the two is huge. It's a huge difference. For most people with autoimmune thyroid, there's either some type of infectious microorganism that's a triggering agent, there's a chemical that's a triggering agent, there's a food that's a triggering agent, and those things need to be addressed and looked into. A hypothyroidism without an autoimmune component, oftentimes it's a nutritional deficit, at least in my experience. I did a wonderful post on this for those of you who haven't seen it. It's the 11 nutrients necessary for your thyroid to properly function. If you go to glutenfreesociety.org and type in hypothyroidism, you can find that article and video. Okay, can you talk about IgA nephropathy and the foods to avoid and foods to eat? Look, I've seen a lot of people over the years with IgA nephropathy, and I actually did a video on this, I think it was last Friday, and it was a research report. So those of you who don't subscribe to me on my YouTube channel, make sure you go over there and hit that bell and that reminder so that you get reminders, because weekly I put up research reports, research updates. When we have new literature and research in science, if there's new diseases that we're finding gluten or other foods are linked to, that's where I do those research reports. And one of the things I talked about on Friday was actually how IgA nephropathy can be caused as a result of gluten exposure. It's actually, now we think IgA nephropathy for some people might actually be a form of celiac disease, or what is oftentimes referred to as silent celiac disease or non-celiac gluten sensitivity. So if you're listening and you have IgA nephropathy and you haven't entertained a gluten-free diet, and I mean a true gluten-free diet, not that standard swill that half the world is recommending to sell you gluten-free products that are full of genetically modified ingredients and sugar, but a true gluten-free diet, and if you don't know what that is, you need to go subscribe to me at Gluten-Free Society, then you should, because IgA nephropathy, in my experience, has always responded really well to diet change. Okay. Luella wants to know if your chemical side is off. Will the body fight back when one is following your advice? Not sure I understand that question, but I'm gonna assume that I understand that question in this way. What I think I hear you maybe saying, and maybe I'm completely wrong, and you can correct me if I am, but if you're doing something on the skin, if something's off on the chemical side and you start addressing it, well, you start to develop symptoms like detox reactions or Herxheimer reactions. It's a pretty broad question, and it largely depends on a lot of other factors. It's not super easy to answer that question exactly. Again, that's even assuming that that's what your question was. Okay. Let's see here. Are air fryers okay? My husband thinks they're awesome, but I don't see it, not with the plastic in them. Yeah, I would agree with that. Like frying with air, when you superheat food, anytime you heat food up to super, super hot temperatures for very long periods of time, especially things that people fry, which generally are carbohydrate loaded, when you superheat carbohydrate, you can create a compound called acrylamide. Acrylamide is a known carcinogen, meaning it's a compound that is known to create or cause or contribute to causing cancer. So I don't recommend high heat temperatures on carbohydrates, especially on carbohydrate based foods. That's sad. I'm sorry to hear that, Barb. Yeah, doctor said the next step was to examine her head and didn't mean an MRI. That's really sickening. Sarah says, how do you treat SIBO and what is the root cause? Sarah, I don't treat disease. Understand, many of you are stuck in that paradigm of treat, cure, diagnose. Get out of that paradigm. That paradigm is broken. That paradigm is so broken, we spend trillions of dollars a year in this country alone on treating and diagnosing, right? I don't believe in diagnoses, and I don't believe in treatment. I think understanding that disease is your loss of ability to adapt to your choices doesn't require a diagnosis. It requires an analysis. It's a different approach. Mentally and philosophically, it's a very different approach. So you ask a different question. You don't continue with the same model. If we look at things as a disease, what does the act of getting a diagnosis actually do? Actually, I love this question because I think it should be addressed. The act of getting a diagnosis. All right, Mrs. Jones, you have MS. Okay. Mrs. Jones gets a diagnosis of MS. What's the first thing that goes through Mrs. Jones's head? I got a bad marker, so I'm going to get a different one here. This is the diagnosis model. You have MS. We don't know what causes it, but we sure have some medicines that we can give you. So the diagnosis itself, and when I'm talking about the diagnosis, I'm talking about, for the most part, all forms of autoimmune disease. There are 140 or so different kinds of autoimmune disease. The diagnoses, generally, when you get one from a conventional doctor, the saying is, we don't know what causes it, but we have a medication that can treat the underlying cause. Like, that doesn't make any sense. You don't know what causes it, but you have a medication that can treat the underlying cause. Well, what's the underlying cause? Inflammation. So we're giving you medicines that block your body's natural ability to produce inflammatory mediators in an attempt to suppress the symptoms that you might experience so that we can improve the quality of your life as you go through it, but not actually address why you're sick. And by the way, the side effects of the medications is we suppress your inflammation and suppress your immune system long enough is that it destroys your gut, it destroys your nutritional status, it destroys who you are as a person, it destroys you chemically from the inside out. So there's really, what happens is, we don't know what causes it, here's the medicines that cause it, that doesn't make sense. So if you analyze that, right, but then that diagnosis leaves you here. Because if you don't know what causes it, then you don't know what to do in order to address it. And that's why I'm not a big fan of a diagnosis. That's why that's not the way I practice. The way I practice is functionally. So I don't care what we choose to call it, because whether it's MS or rheumatoid arthritis or lupus or any other form of chronic autoimmunity, there are triggers. And we know about these triggers. We've known about them for years. They're in medical textbooks. I don't know why medical doctors oftentimes won't talk about those triggers with their patients. I don't know. I can't answer for them. I can't hold them to call because I don't live in their shoes every day. But We know there's triggers, okay? And if we understand that the triggers fall within these categories, then it doesn't become treatment for the disease. It becomes analysis of self-behavior and change of self-behavior so that we get an expression of health to wellness. That's not treating. That's intelligent thinking. And so I just want you to get out of that paradigm of thinking that you need to get a diagnosis and you need to get a treatment, because if you get the diagnosis, the treatment is always going to lead you here. It's always going to be this, and it's always generally going to lead to this, and it's not going to lead to this at all. And the only thing that really puts your body in a position where it's capable of healing, because understand this, your body has everything it needs to heal. The biggest problem people have when they develop illness is they're broken in one or all three of these areas because they haven't done self-analysis properly, or they haven't thought it through properly, or they haven't been guided properly, or they haven't been taught properly. And that's not to say that everybody with autoimmune disease, it's their fault because many people have it, but they don't know why, and if they knew why, they would make action steps or take action to change it. And many people don't care. They want this. And so this part is okay with them. But I would assume that many of you listening tonight, that's not who you are, or you probably wouldn't be here. So anyway, I know I got off on a tangent there, but I think it was an important tangent to get off on. Let's see here. Next question. Can pain in the right back scapula area be caused by the liver? No structural reason has been found. Yes, it can. The liver can refer pain to the right shoulder blade. The gallbladder can refer pain to the right shoulder blade. The pancreas can refer pain to the right shoulder blade. So a number of different organs have referral pain patterns to that area of the body. Let's see, Kristen says, in the process of reading your book, my question is, with many autoimmune disorders, one of them being type 2 diabetes, do you feel that addressing blood sugar and insulin is the best place to start to heal them? I think the best place to start is here. Why here? Because if you just address blood sugar, this is a chemical issue. Blood sugar is a chemical issue. If you're not addressing physical, and you're diabetic, in essence, if you're under-muscled and overweight, and you're not addressing this component, it doesn't matter how much you address the blood sugar if the muscles are not primed and optimized to handle blood sugar as you move forward into the future. So I think you address them simultaneously. As a matter of fact, this is a great question, Kristen, in this regard. This is actually where a lot of people fail, is they only implement one side at a time. I said this earlier, you go to an ortho or a physical therapist and they only focus here. If you go to a lot of times if you go to a doctor, they only focus on the chemical by artificially manipulating your chemistry, not really looking at food, but giving you a drug that manipulates your chemistry. If you only go to a counselor or a psychiatrist, but you have a chemical imbalance or a physical problem, it's what I call, there's a name I have for this, called piecemealing care. When you piecemeal your approach, you're going to get a piecemealed result. You're going to get a partial result, and that's going to lead to frustration because, for example, if you have a chromium deficiency can contribute to blood sugar dysregularity. So chromium deficiency causes elevations in blood sugar, okay? If you address the chromium deficiency, but you also are under-muscled, and being under-muscled can also elevate your blood sugar, you haven't really corrected the blood sugar problem fully. And if you don't pick up on that exercise component, the exercise also plays a role, movement plays a role in detoxification. Movement plays a role in how we take out the garbage. It's how our lymphatic system processes and moves fluid through us and basically helps our immune system get rid of the garbage. So if you're not physically active, you recreate a chemical problem because of this inactivity here. So you end up just kind of bouncing back and forth between the different areas of problems and just recreating new problems because you never took a piecemealed approach, or you never took a holistic approach, you took a piecemealed approach, and you just kind of end up kind of chasing around on these different aspects of the triangle of health. And that's why it's very, very important, if you're addressing it, to address it simultaneously. So any of you that go to a doc and they say, well, let's start with this and let's look at this, or let's start here and let's look here. Look, that won't work. Not really. It's not going to work for most people. You've got to start with everything on this triangle. You can't start with just pieces of it and expect a great result or a great outcome. Let's see here. Interesting question. What about schizophrenia? Dennis wants to know. Well, schizophrenia's original name was bread madness. So where I would, if somebody were like, what can I do with schizophrenia? I'd say definitely you definitely want to start with diet with schizophrenia. I mean, bread madness. It's kind of a synonym. Bread madness is a synonym for schizophrenia, and bread madness is actually caused by eating grain. So I would definitely start there, but again, I would start there, I would start here, I would start here, I would just start in all those areas. Let's see, I'm not sure I get a question out of that one, so I'm going to skip it. Let's see, is insulin resistance Hashimoto? Can insulin resistance and Hashimoto cause sciatic pain? I had an MRI for my low back, found nothing. So why am I having this pain in 5 years? Where to go with this? Look, one of the things that can cause referral pain down that nerve distribution is intestinal problems. So you can start with what you're eating for sure. What do you know about activated charcoal as a detox method? I'm not a big fan of detoxing without addressing where the toxins are coming from. The biggest mistake I see people make doing detoxes is every year, January rolls around, everybody wants to do a detox. Well, what are you detoxing from? And some people would say, well, we live in a toxic world. We have chemicals all around us. We have petrochemicals. We have plastics, etc. Okay, I get that. But if your body's healthy and you're doing a lot of the right things, then you're always detoxing. You don't need a detox program. If you're exercising, you're detoxing. If you're getting sunshine, you're detoxing. If you're getting adequate sleep, you're detoxing. If you're staying adequately hydrated, you're detoxing. If you're eating healthy foods, you're detoxing. You don't necessarily need charcoal in order to perform a detox. You need a consistent set of behaviors within this realm done over time repetitively with consistent intent, and your body will always be taking care of you. Your body will always be detoxifying. So many people look for that magic bullet. What can I do to detox this year? What can I do to detox X, Y, or Z without really thinking about this holistically? If I could impart anything to any of you tonight, it's that don't look for simple, quick supplements to take, simple, quick fixes. This is where it's at. If you want real solutions to long-term chronic health diseases, you've got to address it holistically. You can't address it in a piecemeal. Because if you're using supplements, okay, I'm going to say it. I know we're running low on time, but I feel like it's important enough to bring it up. A lot of people use supplements the way a medical doctor uses drugs. They use it for symptomatic suppression. So what's the difference if I use a medicine to suppress physiology, or if I use a supplement to suppress physiology? It's the same philosophy. A perfect example is taking high doses of something like turmeric to stop inflammation. And there's nothing wrong with using turmeric. The problem is when a person relies on the turmeric to stop the inflammation but doesn't address behavioral change over here. So again, if you're relying on a pill, a detox program, or a supplement to create a suppressive environment where you feel better, but you're not applying the components of this that put you to work, then you're approaching it wrong, and you're going to end up with the same issues. You may not have the side effects of the medications, because a lot of the supplements don't really have a ton of side effects, but you're still not going to end up satisfied. You're still not going to end up in this place right here. So it's important that if you want to be here, these can be tools to help get you here, but these are not the things that get you here. Your behaviors are the things that are going to get you here. And I think that's, if you can walk away from anything tonight, please walk away with that message. Okay, let's see here. think, yeah, I think I got them mostly answered here. Do I know it? So somebody's fighting, looks like Kim is fighting a workman's comp case. I'm going to assume PTSD-CF means post-traumatic stress disorder, chronic fatigue. Do I know a doctor that's gutsy enough to help you take on the lame behind the times work comp system? No, because every doctor that I know that had the fortitude to do anything got out of the work comp system because it's broken. You're not going to fix a broken governmental system with red tape and bureaucracy in place that's layers and miles thick. Unfortunately, and I don't say that to not give you hope. I just don't know of any doctors who stayed in the system who wanted to do this approach, who would be willing to take that on. I mean, you could certainly, you know, look up functional medicine doctors who take nutrition, and you might find somebody in that regard. But again, the problem with functional medicine doctors that take nutrition, or I'm sorry, that take insurance, is that they can't fully live here because insurance dictates too many of the rules. That's why anybody practicing functional medicine for any length of time eventually gets completely out of insurance, because insurance dictates what a doctor is capable of doing. And you can't have a third-party payer dictating the decision between you and your doctor. It doesn't work that way, unfortunately. All right, so I think we'll call it a night. I've given you guys a ton to chew on, and I know some of you, especially if you're new to this might have been hopefully very enlightening and maybe even somewhat mind-blowing for you, because it's just not discussed. This information is just not talked about mainstream. Less than 1% of the population accesses functional medicine. But I felt the calling to share it with you, because I feel like if you haven't heard this message, and I feel like, you know, the old saying, once you know, you can't go back. Like, once you're educated, there's no way going backward. I want you all to move forward. I don't want you going back into that old system that's not going to be helpful for you. So I wanted to get this information into your hands so that even if you don't take action on it tonight or tomorrow or the next day, it stays on your mind, it stays top of your mind, and it helps slowly, even if it's slowly, getting you and moving you in the right direction over time. So remember, that's the goal. We want people to be here. We don't want people to be here. And in order to do that, we've got knowledge is power, and knowledge gives you the power to take the right action. And remember that consistent action over time is what yields results, not magic elixirs, not magic pills, not magic medications. So if you haven't already, make sure you hit the bell button and subscribe to the channel. Make sure you go over and visit us at glutenfreesociety.org. Sign up for our free gluten-free survival kit, and we'll see you back here next Monday night for another episode of Pick Dr. Osborne's Brain. Have a fantastic week.